Hello and welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia. We've got a great episode lined up for you today where we'll be talking about high blood pressure, what you need to know, what you can do about it. And we've brought in a nephrologist, a hypertension expert from Ottawa, Dr. Swapnil Hiremath, to join us. So we had a great discussion with Dr. Hiremath, and we'll be back right after this message. Okay, welcome back. And again, today we'll be doing a great, what I hope is an exciting talk for you guys about hypertension. And I'm pleased to welcome to the show today a colleague of mine, a nephrologist from Ottawa, Dr. Swapnil Hiremath. He's again, an expert in hypertension and has agreed to join us today to answer a few questions. So again, Dr. Hiremath, thanks for joining us today.
Thanks for having me, Mario.
Can you tell us a little bit about yourself and the work that you do?
Sure. So I'm a nephrologist. That's a kidney doctor in Ottawa. I work at the Ottawa Hospital, and I'm an associate professor at the University of Ottawa. I trained in Mumbai as well as in Ottawa, and I have a public health degree as well. And it's good to say that I'm on the Hypertension Canada guideline board. So I do make a part of those guidelines, but whatever I'm saying today is my own personal opinion. I don't speak for Hypertension Canada.
And this is one of the reasons I was so excited to bring Dr. Hiremath on the show today, is that of all the physicians I know, I can confidently say that he's probably the foremost expert in hypertension and high blood pressure. So I'm really excited to have him on today. So I guess we'll start with kind of just a really simple question. And what's the simplest way you can describe what's happening to someone when they have high blood pressure? Like, what does that mean to them?
That's the main problem, right? Because it's just a number, and people say, I feel fine, doctor. Why do you say I have a disease? And that's why hypertension has been called the silent killer. So hypertension, it's high blood pressure, and what that means is that the pressure in your blood vessels is high. So blood vessels are, they carry the blood from your heart to all your organs. And the pressure inside is high. So think about it like, a pipe which has got a flow inside, the blood is flowing inside and the pressure is high. Why does it matter? It's because if the pressure is high, your organs are going to feel that high pressure, and there's going to be damage due to that high pressure. That's one thing. And the other thing is that your heart is the pump that drives this pressure. So your heart is pumping against that pressure. So it has to pump harder against that pressure. So guess what happens? Just like when you exercise and you're pumping iron, the heart muscle thickens. And it becomes harder, which is, you may think it's fine, the heart is stronger, but it's not really like that, because if it's pumping, then it needs more oxygen, which is, its needs go up. And in the long run, because it's pumping harder and harder, things can go down.
Would you say the average person feels any different with high blood pressure? What's your experience been with your patients?
Yeah, and you're absolutely right. The average person does not feel any different, right? They feel fine. And that's the biggest problem with high blood pressure. I have tough time convincing people, saying, hey, you have a condition, it needs to be treated, because they come in feeling fine. You give them a pill and they feel fine, and they're like, do I really need it? So most patients, I would say more than 99% of patients with high blood pressure feel fine. There's a tiny sliver of minority of patients who will, with very severe hypertension, who may have trouble with their vision or headaches or something like that. But truly speaking, headache is sort of thought to be a common problem with high blood pressure, but it's very uncommonly seen. Headaches can be because of any reason, right? A bunch of reasons, nothing to do with high blood pressure. So the fact that it is asymptomatic, that you feel fine, doesn't mean much. It's really the measurement that matters.
Let's talk measurement first, because I know this is something that people ask us about all the time. Where's the best place to check my blood pressure? At the doctor's office? Should I be checking at home? Should I check at the pharmacy or the grocery store? What's kind of your Cole's notes to patients about kind of optimal monitoring for their blood pressure?
The measurement is the key, because without measurement, you really don't know what is going on. So that's number one. And I would say any measurement, especially in the last 1.5 years with the pandemic, any measurement is better than no measurement. So that's number one. If you talk about the gold standard, which is like the best way of measuring blood pressure, that's what we call as a 24-hour ambulatory blood pressure monitoring. So there people wear a cuff, they walk around and over a 24-hour period. Unfortunately, that's not reimbursed in Ontario. At the Ottawa Hospital, we do it for free. Some pharmacies will do it for 30, 40, 50 bucks. But it's a cumbersome procedure. And with the pandemic, it's even harder to do. So people, in the research world, we talk about ambulatory blood pressure monitoring all the time, but in real life, it's rarely done. It's not easily translatable. So what ends up happening is the two ways that people measuring it is you measure it at home or you measure it in the office, in the doctor's office. Now, both of them, there are pros and cons. With anything, it's not like this is the right thing. There's an upside and there's a downside. The upside with measuring it at the doctors is that you've got a professional measuring it often, not always.
Mhm.
The downside is you're going to be worried, right? What is this number going to be? And oh, you're at the doctors for a reason. You're there because you're not feeling well, or you've got a tummy ache, or you've got a bladder infection, or what have you. So that is worrying you. On top of that, someone's measuring your blood pressure. Maybe it's a crowded room, people are talking, all that is going on. So often it's a messy, imperfect number. Um, the ideal way we say that you should measure your blood pressure when you go to the doctor's office is a standardized blood pressure measurement, or we call it an automated blood pressure measurement. So you sit in an office quietly in a chair, your back is supported, your feet are flat on the floor, no one is talking to you. There you rest for 5 minutes, and then the monitor takes a set of 3 or 5 readings and you average that. Now, that's easy for me to say. I work in an academic center. I've got all the time in the world to do this with referred patients. You've got a busy family doctor's office. This may or may not be possible. But that's the ideal, and that really gets, if you're in a quiet environment and you allow the blood pressure to come down, and often it does come down, that gives you a good number. Otherwise, if you're stressed and worried, it may give you an artificially high number. So those are, some cons of doing it in the office. Um, Whereas when you look at doing it at home, you are, in your own home, and you can measure it as many times as you like. You can measure it in the morning, in the afternoon, in the evening. We like those measurements because that tell us what your blood pressure is really at home, right? It's not in the artificial environment of being at the doctor's office. It's being at home, being in your natural environment, doing what you normally do. The other advantage is we can measure it at different times. Maybe your blood pressure is higher in the morning, maybe it's higher at night. We'll pick those things up when you measure it at home. The problem again here is you have to measure it properly. You haven't got a trained nurse who is going to measure your blood pressure. In my clinic, I don't measure blood pressure. I don't trust myself to do it. We get our trained nurses to do it. Nurses are way better at measuring blood pressure than doctors are. So at home, you don't have a nurse to measure your blood pressure, right? So you have to do it yourself. The good thing is that the monitors that we have nowadays are very easy. The cuff is often a size that goes over your arm. It's kind of the size is it's pretty much good for most people, though we can talk about some caveats about exceptions. And you just press a button and you get a number after a few minutes. You just have to do the same thing, right? Make sure you switched off the news. You're not watching what is going on with the pandemic or the latest variant. Or anything like that, or politics, or whatever gets your nerves up. You're not fighting with your husband or wife, and then check your blood pressure. Those things are most important when you do it at home.
This kind of gets to the concept of white coat hypertension. So people may have heard this. So I'll often tell my patients, because I'll have patients who persistently in the office, their blood pressures are routinely elevated, and they'll by this point have a home blood pressure cuff that they've purchased, and routinely home blood pressures both morning and evening are pristine. So these patients, generally I reassure that if blood pressure at home is reasonable, and just in the office is the only time that it's elevated, pretty reassuring. It's certainly possible that there are other stressful times during their day that it's going to be elevated as well. One of the reasons why I do encourage patients who have persistently elevated blood pressures in the office to get a home blood pressure cuff. Some will go to the pharmacy. I'm interested to know what you think about these pharmacy and grocery store cuffs, whether you put any stock in those, or whether patients really should be purchasing their own cuff if they're going to do home monitoring.
So pharmacies are again, any measurement is better than no measurement. So if my patient doesn't have a home monitor and they go and check it at the pharmacy, I'm happy with something. At the same time, the pharmacy is not the same environment. You need to sit down for 4 minutes, 5 minutes, be quiet, and check it a few times. The pharmacy environment may not be like that. And with the pandemic, I heard that some pharmacies shut that down, right, for hygiene reasons. So it's become harder to check it at the pharmacy. So I again, it's better than having nothing, but I encourage having a home office, home blood pressure monitor. Keep in mind that when you purchase a home monitor, there are many fancy things you can get, right? Like if you look for a monitor, many of them have these extra bells and whistles that you don't need, right? They'll do Bluetooth or Wi-Fi and do this and that. If you want to spend the money, sure, but that doesn't mean you'll get a better number, you get a better reading. I personally have a very simple basic Omron that I bought from Costco when it was on on the sale for like $45. That will give you the right number, right? But you made a really good point about the white coat hypertension, right? So it's really important that you do not treat a number which does not need to be treated. So the white coat effect is true. My white coat is back there. I'm not wearing it right now, but it does stress people, and is it because of the doctor wearing the white coat? And some research suggests it's just the action of coming to the hospital. And we see it often, in older people, women more than men, for example, but, it can happen to anyone. And anywhere from, 10 to 30% of people we see whose blood pressure is high may not really be high. The what I was talking about with the automated monitors, where people sit down and and they rest for 5 minutes and do multiple readings, that takes care of some of the white coat effect, but not completely. And really, home readings are the gold standard way. With ABPM, with the ambulatory blood pressure monitoring, or home their own machines, which will tell you about the white coat. So these patients should not be treated. At the same time, that it is telling you something, right? So these people are someone who are, maybe they're worried about their health or what have you, but also these are patients may later on develop high blood pressure. So it's not that you tell them, oh, you're fine, go away, right? So we do recommend checking these people's blood pressure once a year, the home readings again, rather than the office readings. The second kind of thing which sometimes is missed is what is called as masked hypertension. So that's the opposite side, right? The mirror image of white coat hypertension. So these are patients whose blood pressure may seem normal when they see you, but it's high outside. It's kind of a very perplexing phenomena, right? And it's very, very interesting. I try to explain it as being someone who is, who's relaxed when they see the doctor, but their home life or maybe their work life is very stressful. Right. So, it's typically, it's often a middle-aged man who is like, the doctor, they're not worried about the doctor, but, outside they're quite stressed. And it may be the kind of people who doesn't show their stress, but who internalizes it. Again, I'm going a little bit, psychology there, which is not totally true, but it's that kind of a phenotype. So these people have high blood pressure outside, but not when they see the doctor. And the problem with these is, unlike white coat, where, you should not treat them, you should not give them medicines. Masked coat, you should treat them, because if you don't, they get bad stuff happening to them.
Absolutely.
So that's something that's the home readings again are very useful in that setting.
We'll take a quick break now, and we'll be right back after this message with Dr. Hiremath. Welcome back. We're here with Dr. Hiremath, nephrologist from Ottawa, talking about hypertension. And I love what you said earlier about, the most important thing is getting a reading, because there, and this is actually what motivated this episode, is that, patients will ask me now, doc, I want to come in for a physical. I haven't been in a while. I need to be checked. And I tell them literally the one thing that I want patients to do if they haven't been doing. And I think this is where we're going to miss the boat on a lot of people during this pandemic, is just get a blood pressure. That's all I ask of them, is to get me a blood pressure, because we know we're going to be missing a lot of incidental hypertension that we would have found, just patients coming in for unrelated reasons. People not coming in the office for 2-3 years now. If they already hadn't been in for a bit pre-pandemic, and now we've given them a year and a half where they really don't want to come to see the doctor, how much are we missing there? So again, I'll put this in bright flashing neon lights from this episode. The one thing I want people to take away is, if you haven't had a blood pressure check in the last year, get a blood pressure check. If you're being treated for hypertension, that's a different issue and you need to be checked more often. But if you have never been treated for hypertension and never been diagnosed with it, and you've not had a blood pressure taken in the last year, please get one taken, either at your doctor's office. If a friend has a blood pressure cuff, or a family member, borrow theirs. Worst case, go to the pharmacy if that's an option. But just some blood pressure, because we want to make sure that hasn't just been brewing with high blood pressure for this period of time, because it's such a preventable and treatable issue, right? We can talk a little bit about potential complications of having high blood pressure, but you look at stroke risk. and what's the most reversible thing that we have in terms of patient stroke risk is elevated blood pressure for years and undertreated. So let's talk about numbers if we can, Swapnil, because I know this is something that's kind of changed over the years, and patients and even clinicians might be confused by what should we be looking at for a target. So for the average person who has not been diagnosed with high blood pressure, what should they be looking at in terms of numbers when they're checking their own blood pressures?
If you go back 50 years ago, they would say, a blood pressure of 180, that's fine, don't even treat it, right? And then we have changed, and things have become way more intense, especially in the last 10 years. So for a normal, for a person who has no other health conditions, the number we think about is 140 over 90. So the upper number being 140 and the lower number being 90. Anything higher than that is a concern.
And for either number, for either number, I think is something that important for people to know, because they often ask me, well, what if one's high and the other's normal?
Exactly right. Yeah. So the upper one is the systolic, or the lower one is diastolic. Either one of them being high is important. Typically, we see the systolic number being high in the very young people and the very older population. The diastolic hypertension is more commonly seen, when you're in the 30s and 40s. But again, it can happen in anyone. So do pay attention to both those numbers. If either one of them is high, something needs to be done. Now that's Hypertension Canada. And again, talking with different numbers, the American Heart Association has a different threshold. The Europeans have a different threshold, and we won't go there for confusion. But there are many other opinions out there about what should be done.
There was an old study from years ago. I think it was from the 50s or 60s, where the title of the study was treatment of mild hypertension, and part of the inclusion criteria was a blood pressure over 220. And that was how far we've come in terms of being aggressive with blood pressure management, where for the average person, 140 over 90 being the target. So for those who are told they have mildly elevated blood pressure, or they're told just to keep an eye on things, what are some non-medication things that people can look to potentially address their blood pressure?
That's the number one question we get, right? Doc, I don't want to take pills. I feel fine. What can I do? So there are many things you can do. Probably the single most important reason why we have high blood pressure is we consume a lot of salt, sodium. In Canada, in North America, in Western world, we consume a huge amount of salt. Actually, not the Western world, everywhere. I was looking at the data from China. They consume twice as much salt as we do, which is shocking. It's very, very high. So we consume way more salt than we do. There's reasons why our body is wired that way to crave sodium, but we don't need to, right? And we no longer need salt to preserve food. We have got refrigerators, so we don't really need to eat salt. And that's the number one thing you can try to fix. That's easier said than done, right? So if you look at the sources of salt, people will say, oh, I don't add salt at, I don't have a salt shaker. No, the salt that you add while cooking or eating is like less than 5% of your intake. It's mostly baked into the food that you buy, right? We mostly buy processed food. So if you eat 2 slices of bread, you're eating more salt than you should have in a day. If you're someone who loves sandwiches, you're done. Your salt intake is way too high unless you bake your own bread. So it doesn't have to be like pizza or chips or poutine. If you're eating bread, you're done. If you're eating naan bread, done. You're eating too much salt. The reason it tastes so nice and fluffy is because of the salt intake. If you're moving away from that kind of thing, it does, again, it's easy for me to say. It's hard to practice, because what it means is you have to cook your own food. You have to, make your own, fruits and vegetables and do all that. So eating a diet rich in fruits and vegetables, 3 to 4 servings of fruits and vegetables a day, so-called DASH diet, it will also help. Now, partly it's because the DASH diet is low in sodium, but also partly it is because the DASH diet is rich in potassium. And that's the other thing, right? So more potassium and less sodium is helpful to lower blood pressure. So that's the diet aspect. Can losing weight help? Yes. Can exercise help? Yes. But I'm talking about, a good amount of exercise. It's not taking, a stroll. I'm talking about, a 30 to 45 minutes of moderate intensity exercise, at least 5 times a week. That sort of exercise, it will bring your blood pressure down by about 5 millimeters of mercury. If your life is very stressful, being able to bring the stress down, meditation, yoga, mindfulness, what have you, those things might also help. So all these things individually can bring your blood pressure down by roughly 3 to 5 millimeters of mercury, right? So cutting down salt intake, eating more fruits and vegetables, exercise, losing weight, de-stressing your life. Now, if you do all of them together, will it get it down by 25 millimeters? No, it doesn't work that way. You'll probably get, maybe a little bit of additive effect, but maybe 5 to 10 millimeters is the most you can expect. So it's good for someone whose blood pressure is, borderline high. If they're 145, yeah, you can come down to 135. On the other hand, if your blood pressure is 180, these things will help. I don't discourage changing your lifestyle. Changing your lifestyle is forever, right? It will always help you. If not for blood pressure, it's going to help your heart. It's going to help your joints if you lose weight. It's going to be good for you in many, many different ways. So you should always try to do it, but it's also not a quick fix, right? It's something that you have to really change everything you're doing. It's kind of you're not trying to win a battle, you're trying to win a war over the long term. That's how you should think about lifestyle. But there are many things. I have some motivated patients who were able to lose 10-20 millimeters of mercury because they really changed. They were doing a lot of bad things and they stopped doing all those bad things. But often it's not possible. People try and it's not really possible, which is then where it comes to medication. So these patients, I do tell them, do all these things, but you then bring them back in 1 to 3 months to make sure that you're not leaving them untreated for too long.
I give them a defined period of time because often I find if someone's blood pressure is elevated and we agree to give it a trial of lifestyle measures, it becomes kind of kicking the can down the road where you'll see them 6 months later, and yeah, they did it for 2 or 3 weeks, and then things kind of fall off. So usually I'll give them a fairly defined period of time. And like you said, the benefits of these things go well beyond blood pressure management, because I'll have patients who will be intense with exercise and diet and their blood pressure doesn't move, and they're quite discouraged by that. But I reassure them that, two things. Number one, it's helping them, again, beyond just blood pressure, right? It's decreasing their cardiovascular risk, it's decreasing their cancer risk, it's having a whole bunch of positive effects. But secondly, the average patient, as you mentioned, with lifestyle measures alone don't often get as low as we want with blood pressure. And we often do need to resort to pharmaceutical means, which is not a punishment. That just because you've done this, it doesn't mean you didn't work hard enough. I have patients in my practice who are high-level cyclists and eat absolutely clean, and still require 2 to 3 medications for blood pressure because, again, with essential hypertension, it's their own kidneys and their own hormones working against them and driving that. So I want people really to if through a conversation with your physician that medications are being discussed. Again, don't look at this as you failed or you didn't do enough. It's off. Again, perfectly healthy people in any other respect often do need blood pressure management. Any last words of wisdom from the hypertension guru?
Not really a guru, but the medications. Like people don't like medications, but it's really compared to, you were talking about mild hypertension, right? And in that Veterans Affairs study, it was because the drugs we had at that time were like reserpine and guanethidine. They cause impotence. They cause a lot of other side effects. So those drugs we had in the old times were awful. Like people would do lumbar sympathectomy, like horrible procedures. Like it was like not leeches, but pretty close to that. These days we have fantastic medications, right? We have a wide array of pills. If one pill doesn't work for you, it causes, if amlodipine makes your legs swell up, we can stop it and we can give you perindopril. If perindopril makes you cough, we can stop it and give you olmesartan. Like there are so many things we can do. We have a wide, armamentarium of blood pressure lowering pills. So the fact that, if you have a side effect with a pill, make sure you come to the doctor and say, hey, this did not work for me. Can you give me something else? It's very common, right? Like you have an asymptomatic condition and you're given a pill for that and it makes you feel worse. Yeah, you're going to stop taking it. But please come us and tell us that this is not working for this reason, right? And you will not feel any differently as far as the blood pressure is concerned. So we have many different we can give. It's not at all unusual that people have side effects. So that's one. And the second is that needing more pills is also very common, right? So if your blood pressure is high by, say 20, instead of being 140, it's 160, it makes sense to give you 2 pills at once rather than one, because you're wasting your time, right? We give one, it'll come down a little bit, then you have to see the doctor again, then I will say, oh, you need one more, and you feel like a failure, right? Yeah, like you were saying with the, like something is not working out. So we often need to use 2 pills. Most of the patients I see as a kidney doctor are on 4 pills for blood pressure, or who have diabetes and kidney disease. It's often 4, 5. It's pretty common. Don't think that you're on all these pills for something that has no symptoms. There's a reason. High blood pressure can cause kidney failure, it can cause stroke, it can cause heart failure, it can cause problem with your visions. It's the number one cause of disability worldwide. So take it seriously. Try to change, eat healthy, and if your doctor says take your pills, go ahead, take them.
So thanks again to Dr. Swapnil Hiremath, nephrologist from Ottawa. It was a great conversation, and I hope that a lot of you took away some important information about high blood pressure, either for yourselves or friends or family, and you can pass on those messages. So until next week, stay healthy.